If you're in a regulated industry, you've probably got a CAPA process that looks pretty solid on paper. But here's the reality. When an FDA investigator sits down and asks for evidence, that's where most CAPAs start to unravel. They were built as documentation exercises, not to withstand real scrutiny. And that gap surfaces fast in an inspection, usually as a Form 483 observation. Leave it unaddressed, and you're looking at a warning letter. Today, we're going to break down exactly what investigators verify in a CAPA review and what it takes to build a system that actually holds up. First, let's clarify some critical terms, because this is where a lot of problems start. CAPA stands for corrective and preventive action. It's a closed-loop process with distinct stages. A correction is an immediate fix for a specific nonconformance, for example, pulling a bad part or fixing a bad label. Corrective action goes further. It eliminates the underlying cause so that particular problem doesn't recur. And preventive action looks even broader. It's about proactively addressing potential issues in other parts of your operation before they manifest. Conflating these is a surefire path to trouble. Get the definitions right, and the rest of the process falls into place. Remember, quality organizations aren't only audited on effort, they're audited on evidence. All right, let's make this concrete. Suppose a batch of mislabeled product reaches a customer, triggering a complaint. That's a typical entry point. A complaint, an audit finding, a deviation report. The investigator's first question will be, how did that complaint enter your CAPA system? They're verifying that issues like this aren't getting quietly filtered out before a CAPA ever opens. A company that closes complaints without a corresponding CAPA can look deceptively clean on paper. Experienced investigators, however, know the difference between a system that's genuinely in control and one that's simply underreporting. From there, they'll trace the entire chain of events, checking for 3 key elements. 1. A timely problem documentation. 2. A rigorous root cause investigation. And 3. A corrective action that directly addresses that cause. A missing link anywhere in that chain turns the whole CAPA into a finding, regardless of the effort invested elsewhere. Now, root cause is where many organizations stumble. In our mislabeled batch example, the immediate correction is straightforward. Quarantine the lot, relabel, release. But that does nothing to establish why the mix-up occurred in the first place. This is the failure point for many CAPAs. Teams document the correction and consider the matter closed. Fixing the immediate problem and preventing recurrence are 2 fundamentally different tasks. Effective root cause analysis often means deploying tools like fishbone diagrams or iterative 5-why techniques to move past human error and arrive at true systemic factors. In our scenario, this might reveal an ambiguous work instruction that allowed multiple label versions to coexist on the line. With the root cause identified, the real corrective action can take shape. It must be targeted, assigned, implemented, and documented. Here, that could mean revising the work instruction to enforce single version control. Then, and this critical step is chronically overlooked, you must verify the effectiveness of the change. An effectiveness check starts with defining clear, measurable success criteria at the outset. For instance, 0 labeling discrepancies on the affected line over 1 full production cycle. Then it requires actually monitoring performance against that standard before closing out the CAPA. In the eyes of an investigator, a corrective action that looked flawless on paper but was never validated against real post-change data is indistinguishable from one that failed. The most frequently missed link in the CAPA chain? Training. Revising a procedure is only a meaningful corrective action if the personnel executing the process are verifiably trained on the new version. When an investigator reviews a CAPA that cites an updated work instruction but finds no record of operators being retrained, that's an automatic gap, even if the revision itself is textbook. And if that training documentation is simply absent, take my word for it, won't cut it. They'll go straight to the floor and interview the operators directly, asking them, show me you understand the current procedure. It comes down to this. Your QMS documents the fix. Your LMS proves your workforce can implement it. The 2 must function as an integrated system. In our experience, 4 mistakes drive the vast majority of CAPA-related inspection findings. 1. Mistaking correction for corrective action. Quarantining a suspect lot isn't a systemic fix. 2. Shallow root cause analysis that stops at human error without examining error proofing. 3. Closing CAPAs with no documented effectiveness checks. 4. Procedure updates disconnected from training records. On the surface, each of these masquerades as a completed CAPA. Under real investigative pressure, however, each collapses into an open finding. A CAPA is only as resilient as its weakest point. Think of it as an unbroken sequence. Trace the problem to its origin, unearth the true root cause, implement and verify a systemic solution, and maintain the gain over time. If you have one missing link, the whole chain fails when challenged. This is precisely the thinking behind eLeap's unified EQMS and LMS architecture. When a CAPA procedure change triggers a retraining requirement, as in our work instruction scenario, the system can automatically assign that training and suspend the CAPA closure until the learning is complete and documented. From the investigator's perspective, it's one coherent, closed-loop process rather than two siloed records to manually reconcile. The takeaway is simple but profound. Investigators are auditing the evidence your CAPA system generates, not the effort you invest. Close the loop with rigor, and that CAPA record becomes an unassailable asset under inspection. For those of you managing CAPAs in regulated environments, we're curious to hear from you in the comments. What's the most prevalent root cause category you encounter? Process design, training, or equipment issues? We follow every discussion. And if you found this valuable, be sure to subscribe to catch the next in our series, where we'll dive deep on root cause analysis itself. If you have questions about how eLeap can help you streamline your CAPA process, contact us for a demo today.